Good afternoon. I would like to call to order this public hearing, of the Committee on the Judiciary and Public Safety. It is 12:58 p.m. on Thursday, March 21st, 2024. And we are conducting the hearing in person in room 412 of the John A. Wilson Building and streaming on the DC Council's website and YouTube and Twitter at CM Brooke Pinto. I am Councilmember Brooke Pinto, representing Ward 2 and Chairwoman of the committee. We have two items on the agenda today. First, the Bill 25-460, the Transgender and Gender Diverse Mortality and Fatality Review Committee Establishment Amendment Act of 2023. And second, proposed resolution 25-591, the District of Columbia Sentencing Commission Sean Holohan Confirmation Resolution of 2024. We'll start today with Bill 25-460, the Transgender and Gender Diverse Mortality and Fatality Review Committee Establishment Amendment Act of 2023. I introduced this bill on September 18th of last year, along with council members Christina Henderson, Robert White, Charles Allen, Vincent Gray, Matt Fruman, Janice Lewis-George, and Anita Bonds. That year had begun with the district marking a grim milestone. The death of Jasmine Starr Mack on January 7th, 2023, was the first transgender person in the country to be violently killed in 2023. And they lived and died in the district. Despite transgender and gender diverse people only making up approximately 1.6 million of the population of the United States, mortality, fatality, and morbidity trends for this group compared to cisgender people are disproportionately high. Although data are limited, some studies suggest that transgender people are, quote, twice as likely to die as cisgender people due to heart disease, lung cancer, HIV-related illness, and suicide, with trans women being 2 times as likely to die compared to cis men and 3 times as likely compared to cis women. Trans women in particular are disproportionately vulnerable to these risks, as well as to the violence and murder, with 1 in 4 trans women likely to be victimized by a hate-related crime. Meanwhile, trans women of color are even more overrepresented as victims of violence and murder. Transgender fatalities from violence have continued to rise in recent years, making the need for urgent policy intervention especially pressing. All of this suggests that trans and gender diverse people may face particular vulnerabilities that cisgender people do not. There is thus an urgent need for more information about trans and gender diverse people's lives and their deaths, so that the district could properly support health outcomes for this constituency. To facilitate this important work, my bill would establish a Transgender and Gender Diverse Mortality and Fatality Review Committee. This committee would complement the district's existing mortality and fatality review administered by the Office of the Chief Medical Examiner, or OCME. The proposed committee would consist of representatives from OCME and other relevant district agencies, representatives from district hospitals, transgender and gender diverse advocacy organizations, housing organizations, healthcare providers, researchers from a college or university within the district conducting research in this area, and social workers specializing in transgender and gender diverse issues. The committee would be tasked with identifying and characterizing the scope and nature of transgender mortalities and fatalities, recording trends, conducting retrospective socioeconomic analyses, and working to develop policy recommendations that are aimed at reducing premature deaths of trans and gender diverse people. There are 2 things about this bill that I want to highlight briefly, one practical note and one broader note. First, as a practical note, this bill builds off the existing practical and legal infrastructure that exists between OCME and the Department of Health. And the new committee is legally modeled on existing review boards and other committees in order to ensure the privacy, confidentiality, and anonymity of information for trans and gender diverse people. And second, this bill is motivated by a desire to improve trans and gender diverse lives. My hope and expectation is that this committee will continue the district's leading role in LGBTQIA+ advocacy and legislation. And as the first entity of its kind in the United States, it will contribute important data and analysis and provide important resources for the National Center for Fatality Review and Prevention and for transgender and gender diverse people across the country, and will inform future strategies and interventions to drive down the disparate outcomes we are currently seeing with our transgender and gender diverse residents. We will then move on to a public roundtable to discuss proposed resolution 25-591, the District of Columbia Sentencing Commission, Sean Holohan Confirmation Resolution of 2024. The commission was created in 2006 for the purpose of producing voluntary sentencing guidelines for judges in the district in order to ensure greater consistency and fairness in sentencing. The Sentencing Commission is also broadly responsible for analyzing sentencing data, policies, and practices, both in the district and across jurisdictions. This includes tracking case-by-case sentencing and compliance with the sentencing guidelines. Finally, the Commission produces recommendations to the courts, the council, and executive agencies on enhancing the fairness and effectiveness of criminal sentencing in the district. The commission is currently composed of 12 voting members and 5 non-voting members, although my recently passed bill, Secure DC, Bill 25-345, and its emergency version increases the district representation on the commission by adding additional voting members, 1 additional representative from the mayor and 1 additional representative for the council, as well as the chief of police. Of the council's 2 appointed representatives, 1 must be a returning citizen and 1 a victim of violent crime. This will ensure balance and diversity in perspectives on this fundamentally crucial commission. Sean Holohan is a Ward 1 resident who currently works as the state legislative director of Giffords, a national organization established by former Congressperson Gabby Giffords, dedicated to combating gun violence through state legislation. Prior to that, he worked at the Rape, Abuse, and Incest National Network, otherwise referred to as RAIN, as a policy manager for federal and state campaigns. RAIN is a well-known national nonprofit that works to promote research and policy changes to reduce rape, abuse, and incest. Mr. Holohan's work at RAIN involves sustained work in government affairs. This work was preceded by a directorship and advocacy at NARAL Pro-Choice, another national nonprofit that advocates and lobbies for the protection of reproductive freedoms and women's health. Last, Mr. Holohan has past experience as chief of staff for a state legislator at the Virginia General Assembly. Mr. Holohan currently serves as an ANC commissioner for 1B02 and recently finished a 2-year term on the Concealed Pistol Licensing Review Board. I'm looking forward to hearing from the nominee about his vision for the commission, how his professional experience will inform his participation if confirmed. For today's hearing, we are first beginning with Bill 25-460. We will hear first from public witnesses and then from our government witnesses. As usual, public witnesses will have 3 minutes to present their testimony, and those who represent organizations will have 5 minutes. I will call our first panel and our only panel of public witnesses here who are all joining us virtually. Dr. Clint Peebles, Vincent Slatt, Deborah Steinberg. Dr. Clint Peebles, Director of Medical Society of the District of Columbia.
Thank you so much, Chair Pinto and committee. The Medical Society of the District of Columbia is the largest medical organization representing metropolitan Washington physicians in the district. We advocate on behalf of all 11,000 plus licensed physicians in the district and seek to make the district the nation's model for patient care and physician practice. And thank you so much for allowing us to provide commentary today on B25-460. MSDC supports this very admirable legislation as it would allow the district to lead the nation in an effort to gather information on violence against transgender and gender diverse individuals. This legislation could not be more timely. So far, almost 500 anti-transgender bills have been introduced this year alone across at least 41 states, threatening every aspect of the ability of trans people to live authentically and safely without fear or stigma, especially those individuals of color and with other intersectional marginalized identities. Because of anti-transgender legislation, the largest survey of gender diverse people ever undertaken to date shows that 40% of transgender individuals in the US have considered relocating because of discrimination or unequal treatment, and 10% have already in fact done so. As a result of this climate, almost 90% of trans youth say that these legislative debates have negatively impacted their mental health. And concurrently, we're seeing rising rates of violence and other crimes against transgender people. Transgender youth are significantly more likely to be bullied and to feel threatened at school than their cis peers. And a recent Washington Post report showed that school hate crimes targeting LGBTQ plus people have risen sharply in recent years, with the number of hate crimes on K through 12 campuses more than quadrupling in states with restrictive laws. And even in more liberal states, absolute numbers of crimes are higher as well. And FBI hate crime statistics indicate a 30% increase in crimes against trans people from 2020 to 2021. And relative to other groups, trans victims were most likely to be murdered by their assailants relative to other types of crime. As a physician who specializes in LGBTQ culturally humble care and gender affirming medicine, this legislation is critical now more than ever. In DC, my patients remain concerned about safety and well-being in not only the healthcare setting, but also while navigating about daily life. Some have even moved to the DMV area from states with discriminatory legislation to seek refuge, safety, and affirmation. DC has a strong record of supporting the gender diverse community, and this will further signal that the trans community is valued, prioritized, and fundamentally affirmed. And in particular, regarding this legislation, MSDC supports the inclusion of a representative from the trans and gender diverse healthcare provider community. And we would urge the committee to consider a physician for that role. The DC medical community has multiple clinics and practices dedicated to the culturally humble and excellent care of gender diverse patients, including centers at GW, Whitman Walker, and the Mid-Atlantic Permanente Medical Group, among others. And the perspective of a physician who works directly with this population would be an invaluable asset to the work of the committee. Please reach out to us at MSDC if our membership can be of assistance on this or any other issue, and we applaud you for bringing this forward, and thank you so much for your time.
Thank you very much, Dr. Peebles, for your testimony. Next, we will hear from Vincent Slatt, the chair of the ANC Rainbow Caucus.
Good afternoon, Chair Pinto, members of the committee. My name is Vincent Slatt, I'm ANC Commissioner for DuPont Circle 2B. I also serve as the chair of the ANC Rainbow Caucus. The Rainbow Caucus is a group of out LGBTQ commissioners from across all 8 wards of the district, who both serve our single member district constituents and serve as at-large commissioners for LGBTQ affairs. We have reviewed this bill and are in favor of it, and we have a few concerns about the legislation that we'd like to raise. I have submitted written testimony to this fact, but I'd like to briefly mention we have concerns about a lack of a mechanism for the general public to refer cases and instances to this committee, rather than solely having it fall on the DC government to refer cases. There also should be some manner for the general public to put forward that a particular decedent should be reviewed by such a committee. Secondarily, we have a concern encouraging greater participation from the mayor's office of LGBTQ affairs in all of the committees of the OCME. There are, I believe, 5 or 6 of them already. One concern that we have in this new committee is the intersectionality of a particular decedent who may, belong in any or multiple of those committees and how that work is done. So we encourage that the Mayor's Office of LGBTQ Affairs participate in all of those committees. Because of that recommendation and the expansion of this mandate for the Mayor's Office of LGBTQ, we're also encouraging that you add full-time staff to that office. They are already coordinating a violence prevention and response team that works on matters related to hate crimes, gender and trans and gender diverse individuals, and strengthening that work, incorporating it here within this bill would be a powerful statement of the importance of this, and also would require additional staff. I will have to say that Mayor's Office of LGBTQ Affairs is doing an excellent job, and yet our commissioners are concerned that their mandate is ever expanding with a lack of resources. The last point I'd like to make today is concerning the definitions section of the bill, where it asks for a written statement by a decedent attesting to their status and identity as a trans or gender diverse person. This appears to present a burden on individuals needing to go through a specific government process to declare themselves to be an out trans person. This is not always the case and presents a burden to have to deal with the government in order to qualify for this kind of attention. So we'd encourage you to expand that to include public statements that can be attested to by witnesses, or any kind of recordings or other ephemera that a decedent may have left that could indicate their own identity as a trans person, or other mechanisms you might find. The last point that we'd like to raise a concern on is in terms of collecting and destroying the records. I'm not exactly certain what the other OCME offices do in terms of the personally identifiable information. This bill calls for destroying those records within 1 year of the investigations. I'd urge you to contact the DC archives to establish a records retention schedule that could maintain that concern around PII, but also allow for oversight and audits of these investigations by the council, other government agencies. We'll see who would need to do that, but adjusting those would be a concern. Lastly, we'd like to say that the ANC Rainbow Caucus wrote a letter of concern when Jasmine Star Parker Mack was killed last year. And we were grateful for Chairperson Pinto's response to that, and for all of the work on her team in establishing this bill and moving forward. We commend you and all of you. Thank you.
Thank you so much, Commissioner Slatt. Going to come back with some questions at the end. But I want to turn now to Deborah Steinberg, the Public Policy Chair for the American Foundation for Suicide Prevention National Capital Area Chapter. Go ahead.
Thank you, Chair Pinto and the Committee on the Judiciary and Public Safety. My name is Deb Steinberg, and I'm the Public Policy Chair for the American Foundation for Suicide Prevention National Capital Area Chapter. We thank you for introducing this legislation and for the opportunity to testify in support of B-25-460, the Transgender and Gender Diverse Mortality and Fatality Review Committee Establishment Amendment Act of 2023. This legislation would create a committee that would determine the causes associated with transgender and gender diverse mortalities and fatalities, and create a strategic framework for improving LGBTQ+ health outcomes. We support B-25-460, and we are grateful that this legislation would improve the data collection on deaths in the LGBTQ+ community and allow the district to develop more targeted suicide prevention efforts to save lives in this population. Suicide is a complex health issue that disproportionately affects lesbian, gay, bisexual, transgender, and queer people. In the United States, no jurisdiction or agency routinely or systematically collects information about individuals' sexual orientation and gender identity at the time of death. While the rate of suicide among LGBTQ plus people is unknown, information about suicidal thinking, plans, and attempts have been made available because of efforts to include sexual orientation and gender identity on national health-related surveys. Research indicates that LGBTQ plus individuals and youth and young adults in particular are at a greater risk for seriously considering and attempting suicide compared to their straight cisgender peers. Transgender youth report an even higher prevalence of suicide attempts than their LGB or straight peers. Research shows that at least part of the reason for the elevated rates of suicidality and poorer mental health found in the LGBTQ plus community is the social stigma, prejudice, and discrimination associated with minoritized sexual orientation. Across the lifespan, LGBTQ plus people commonly experience individual discrimination in the form of personal rejection, hostility, harassment, bullying, and physical violence, particularly gender minorities with intersecting identities, such as transgender and non-binary people of color. While experiences of stigma and discrimination increase risk of depression and other risk factors for suicidality, protective actions like increasing acceptance and affirmation of LGBTQ plus identities and increasing access to LGBTQ affirming physical and mental health care reduce the likelihood of LGBTQ suicide attempts and death and promote well-being. Effective suicide prevention strategies require complete, accurate, and timely data about who is dying by suicide and the circumstances surrounding those deaths. This is even more vital when increasing the effectiveness of efforts targeting high-risk populations like our LGBTQ plus community. Reviewing and assessing the data helps identify trends and patterns that might otherwise be overlooked. The establishment of the Transgender and Gender Diverse Mortality and Fatality Review Committee will provide officials in DC with much needed data and will assist in the development of effective suicide prevention strategies and policies for our LGBTQ plus community. We urge you to pass B 25-460. Thank you for considering our views, and we would be happy to answer any questions.
Thank you very much, Ms. Steinberg, and thank you to all of our public witnesses for being here today and your testimony on this bill and the very important work that you each do for our city. I want to ask you, Dr. Peebles, as we think about the current structures we have in place and why this bill is necessary, OCME has started to develop some LGBTQIA plus focuses and clusters in its fatality and mortality review committees. And I really appreciate the committee's effort, but I think those measures should be done in addition to rather in replace of this bill. And there's no jurisdiction in the United States that dedicates a mortality or fatality review committee specifically to trans and gender diverse people. OCME also doesn't have in-house trainings for investigators to learn about trans and gender diverse decedents. And so with this in mind, can you share your impression as to why just developing an LGBTQIA plus focus isn't as useful as having a specific committee filled with trans and gender diverse experts and stakeholders?
Yeah, I mean, I think it's important because we have to center the voices of the people who have that lived experience, right? And I think that the cultural humility and structural competency trainings, they only go so far in terms of ensuring that we have no biases in these proceedings and on these teams. And most importantly, that we actually are centering the people that we're intending to serve. So I think that, while it's important to have some of these processes in place where we have appropriate training for example, cisgender folks, despite whether they have intersectional identities or not, I think it's also critical to kind of bring gender diverse individuals to the table too, just because of that experience they have, not only in their own lives and families, but also with the experiences they've had navigating about these structures in their own lives, and they can see the blind spots that others may not necessarily be able to. But I'm not sure if that answers your question or not. Happy to clarify though.
Yes, it does. Thank you so much. I think that's a great point. And Ms. Steinberg, from your perspective, is there currently an information gap right now for transgender and gender diverse people that this bill can help correct?
Yes, absolutely. Thank you for the question. This is data that is not routinely collected, and as a result, it is preventing us from making targeted prevention strategies, both for suicide and for other fatalities and mortalities. So we think starting to collect this data would be an incredible first step in allowing the district to do better prevention.
And are there any pieces of data or missing gaps that you think would make this bill stronger that would be helpful for the work that you do in making sure that we're using data to inform and drive forward more interventions early?
I think that's a terrific question, but most of the data that I would love to see is going to be hard to collect. I appreciate Mr. Slott's point about how any of those barriers, like requiring government intervention to identify someone's LGBTQ identity or status, is just going to prevent us from doing the job that we want to see done. So to the extent that other data is available, like if they have a mental health or physical health condition, that sort of thing would allow us to get a better sense of whether that person was receiving treatment, whether more could have been done. But I don't want to create any additional roadblocks that would prevent these deaths from being properly investigated. So I'm not going to suggest anything else at this time, but I really appreciate the question.
Got it. Okay, thank you. Yeah, no, I'm happy to hear the pushback on that as we try to determine the balance of making the barriers as low as possible, and as inclusive as possible, and also providing clear direction to the agency about when these cases should be referred to this specific committee. And so that is something that we will continue to grapple with. And so that's helpful. Commissioner Slatt, thank you so much for your testimony and for your work with and leading the ANC Rainbow Caucus. I think that your points were very instructive for this bill raised in your testimony. And I appreciate your recognition of the murder of Jasmine Star Mack through the caucus's letter to the council last January. And this remains a really powerful testament to the caucus's efforts to reduce and prevent hate crimes and violence that our trans and gender diverse residents are experiencing. I want to ask a couple clarifying questions. So the mechanism for referral in this bill is from DC Health to the committee, not just OCME. And so I really appreciate your idea of incorporating community referrals as funneled through the mayor's office of LGBTQ affairs, perhaps along with DC Health. How do you envision this type of referral working in practice?
Well, I think that it could work in practice through further outreach from the mayor's office of LGBTQ affairs, allowing people to know that there is such a program, that people can come forward and refer such cases. Many of them are not known. Since that murder last year of Jasmine Star Parker, there have been 2 additional deaths of Black trans women here in this city. And those are just the ones that we know of. And so it's often up to the friends and family, the chosen family of these people, if not the birth families, to come forward. It's the journalists that contact us concerning such events. Often I hear it from blogs or journalists reaching out to me. Rarely are we informed by MPD. I have been working with them to try to get them to inform commissioners when a hate or bias crime or incident occurs in our SMD. That's an ongoing situation we're working on. I'd love to see commissioners informed of this kind of thing. It provides another way for the information to get shared. Because of this, it's paramount that the mayor's office of LGBTQ affairs get additional staff to work in this area.
Okay, thank you. Yeah, I think that is an important point too, as we continue to expand the footprint and outreach that we need for the mayor's office of LGBTQ affairs to make sure that that comes with associated staff and funding. I'm appreciative of your suggestion to expand the definition of documentation memorializing trans or gender diverse status to include public statements attested to by witnesses or recordings by or of the decedent. I just want to note that the definition list, as we currently have it structured, is non-exhaustive. It says it may include, which means that this type of thing could definitely be incorporated, but I would like to continue working with you on this as I was just speaking about with Ms. Steinberg, seek to get that balance right of being as inclusive as possible and as low barrier as possible, while also providing clear guidance to the agency of who qualifies.
Yes, yes, ma'am. I think that's important and we should work on that. Especially, I think, reaching out to some of our trans activists, especially the families of those recently killed. I believe there are several unsolved cases still pending with MPD. And even discussing with some of the MPD investigators some of this information. How are we identifying? How are we finding proof of this kind of thing, that someone had this identity? We also know that oftentimes people are not even out at work. They may not want their neighbors to know that they're trans or gender diverse. And so we'd like to have it listed in the legislation that it is open to other such types of documentation to come forward. Referrals from the community, I think, is an important part of that. If it be nonprofit organizations, faith-based groups, the commissioners are kind of our local 2,000 neighbors right around the corner. It could come in a variety of ways. And so I think having a little more dialogue, some public meetings, I think will help us flesh that out.
Got it. Okay, I think those are all great ideas. Thank you so much.
Yes, ma'am.
And thank you again. Thank you to all of our public panels for being here today. Really appreciate your valuable feedback. And my team and I look forward to continuing to work with you all throughout the development of this bill so that we can save lives. But thank you very much.
Thank you. Keep up the good work.
I will now call our government witness, Jenna Bibi-Ari, the Supervisory Fatality Review Program Manager. Am I pronouncing your name correctly? I'm sorry.
Yes, BBIE.
Thank you. I understand that Ms. BBIE is joined by Rodney Adams, the OCME General Counsel. This is the second time recently that you all are joining us in the Wilson Building, so thank you so much for coming back. As you all know, it is the tradition of this committee to swear in all government witnesses who appear before it. So if I can ask you both to turn your microphone on. Yep. And raise your right hand. Do you swear or affirm under penalty of law that the testimony you're about to provide before this committee and the Council of the District of Columbia is the truth, the whole truth, and nothing but the truth?
I do.
Thank you. I now would like to invite you to make any opening statement you may have.
Thank you. Greetings, Chairperson Pinto and members of the Committee on the Judiciary and Public Safety. I am Jenna BBIE, Supervisory Program Manager of the Fatality Review Division in the Office of the Chief Medical Examiner. I am joined today by the OCME General Counsel, Rodney Adams, and am delivering the executive testimony on Bill 25-460, the Transgender and Gender Diverse Mortality and Fatality Review Establishment Act of 2023. Bill 25-460 proposes establishing a Fatality Review Committee to identify and review the deaths of transgender and gender diverse persons, to develop policy recommendations for systemic improvements towards the elimination of disparate outcomes. The District of Columbia leads the nation in supporting LGBTQ+ rights. The executive has long demonstrated its support for LGBTQ+ affairs, and along with council, created the Mayor's Office of Lesbian, Gay, Bisexual, Transgender, and Questioning Affairs as a permanent cabinet-level office. The office's mission is to address the important concerns of the district's lesbian, gay, bisexual, transgender, and questioning residents through empowering young LGBTQ+ community leaders, removing barriers for LGBTQ+ business owners, building a cohesive LGBTQ+ community across all 8 wards, and providing resources for at-risk LGBTQ+ populations. The executive thanks Chairperson Pinto and the legislative team for their leadership and advocacy on this issue. While the executive understands the intent and supports developing ways to identify and reduce poor outcomes for transgender and gender diverse persons related to health risk, housing and financial insecurity, substance use disorders, and violence leading to fatalities, implementation of the proposed legislation will be remarkably challenging for OSME and partner agencies. The executive has three main areas of concern. First, identification of transgender and gender diverse deaths. Second, manner, type, and volume of cases to be reviewed. And third, district-wide agency staffing burden and additional resource needs. The executive supports the need to ensure that quote-unquote non-consensual detransitioning or dead naming an individual after death does not occur, and instead supports efforts to preserve an individual's preferred identity. DC Health tracks public health issues, including all deaths that occur in the district and deaths of residents who die outside of the district. The process for identifying transgender and gender diverse persons, as outlined in the proposed bills, are dependent primarily on DC Health's identification of individuals who are not cisgender. This process, however, is dependent on a transgender or gender diverse individual having taken one of the following steps: completing the death certificate gender marker pre-registration application, changing their driver's non-driver's license to reflect a gender marker, or getting a gender marker on an updated passport or social security document, which would need to be available at the time of death. The legislation also broadly indicates that if an agency does not have a procedure already in place to identify transgender and gender diverse individuals, they will be required to establish such a procedure in writing with the assistance of the MOLGBTQ+ agency. The legislation does not indicate how district agencies should track the information or which agency would manage and store the information and provide systems level monitoring. Most human services agencies in the district do not have a process in place to readily identify transgender and gender diverse people. Recording gender identity outside of legal documentation is subjective and places an intrusive burden on individuals. For example, a decedent may have identified as an alternate gender in some situations, but not others. The self-identification may be obvious in some circumstances, such as those of surgical altercation, attire, or behavior at death, but quite often it is not. There is currently no objective criterion for death investigators to utilize for labeling decedent gender identities, as well as how to handle objections by next of kin and other family members. Therefore, as part of implementation considerations, any procedures establishing the identity of a transgender or gender diverse person must include formal documentation to be used as verification. This will require adaptations to existing fields on service assessments and resulting records, and creating additional variables in case management systems to reflect gender identity preferences. These systems should feed data into the DC Health vital records to ensure concordance and provide accurate surveillance. The cost associated could potentially be substantial, and the financial figures have not yet been contemplated. The second area of concern relates to the volume of cases to be reviewed once transgender and gender diverse individuals have been identified. Using current OCME data, there were few cases, 17 cases in 5 years. Most of the 14 accidental deaths of identified transgender individuals were drug overdoses, which would fall within the Opioid Fatality Review Board scope of review. Although there will be transgender and gender diverse individuals that fall into the categories for review by the other fatality review committees, such as violence, developmental disabilities, opioid, maternal, and child, the identifications of said individuals cannot be made until the fatality review staff are notified by DC Health. Once obtained, staff will begin to review medical records, medical insurance claims for service, and narrative summaries from various human services agencies, such as housing, mental health, financial, employment, substance use, law enforcement, etc. Deaths that occur due to natural causes are not currently reviewed in the district outside of developmental disabilities, child fatality, and maternal mortality review committees. Roughly 3,500 people die in the district each year due to natural causes. DC Health's vetting of transgender and gender diverse individuals could reveal a small or extremely large volume of cases that would be required for review under the proposed legislation. The goal of creating a fatality review committee focused on natural deaths of transgender and gender diverse individuals, as opposed to the general population, is not stated in the legislation. The executive is not aware of non-cisgender people composing a disproportionate number of preventable natural deaths in the district. Turning to agency-wide staffing and resource needs that would be required to implement the facets of the proposed legislation, several new positions would need to be funded. Due to the current workload of the fatality review entities supported by OCME, an additional manager is already needed and would absolutely be necessary if another committee was added to the roster. A minimum of one full-time fatality review specialist would need to analyze records and coordinate meetings, and a staff assistant would be needed to request and manage records. Several of the fatality review entities currently use a combination of case study and statistical analysis to manage workloads. For example, most committees and boards can only dive deeply into 20 to 24 cases per year due to the volume of touch points decedents had with city services. This requires reviewing records of sometimes up to 20 different agency service providers, in addition to hundreds of pages of medical, mental health, substance use, law enforcement, and court records. For communities with upwards of 400 or more cases to review, the remaining cases are analyzed only on a statistical basis. The impact on DC Health and other agencies to implement the proposed bill is likely substantial as well. Other agencies already struggle to provide records that the fatality review entities request due to limited staffing, and almost all do not have dedicated staff for this purpose. The leadership of other agencies place this as other duties as assigned on their staff, which makes it a low priority and often delays the receipt of records in a timely manner, especially depending on the volume of decedent caseload and the enormity of agency service involvement of the decedent. The executive recommends taking the following course of action until such a time as more concrete information can be ascertained as to a more accurate number of transgender and gender diverse cases for potential review. First, adding a representative of the Mayor's Office of Lesbian, Gay, Bisexual, Transgender, and Questioning Affairs to the relevant fatality review committees, and utilizing the existing review structures to review transgender and gender diverse cases when identified. Second, funding adequate support staff for these fatality review committees and for district agencies to identify non-cisgender decedents and in-depth retrospective case assessments. Third, requiring a representative of the Mayor's Office of Lesbian, Gay, Bisexual, Trans Affairs to provide a presentation to each fatality review committee on a quarterly basis on areas they have identified as needs for service for improvement of services, with suggestions for satisfying such needs, including the status of conducting funded research and demonstration projects to test the suggestions. This information should be added to the annual reports of the relevant fatality review committees discussing issues and recommendations for this population. The executive looks forward to working with the committee on this legislation to ensure it addresses the concerns as outlined above prior to the implementation of a transgender and gender diverse fatality and mortality review committee. Thank you for the opportunity to testify. I look forward to discussing any questions you may have.
Great. Thank you so much, Ms. BBIE, and thank you to you and your team for all of the important and hard work that the Fatality and Mortality Review Committees and boards do every day on behalf of our city. It is a really key part in contributing to our public safety and health ecosystem. I know that in addition to your testimony, the agency has provided feedback on this bill to the committee in a letter and in other exchanges with my team. And I appreciate that the agency has been willing to give feedback throughout this process. I want to address some of the concerns that you all have expressed to the committee in your testimony and in previous correspondence. And my hope is that we can clarify any misunderstandings and find ways to work together to improve this bill. So first, I want to address the concern that you all raised about the number of cases being too few. And that it's not enough to justify a whole new committee. Now, I want to remind us that the outset, of course, there will be a fewer total number of cases as compared to the total population, since transgender and gender diverse people only make up an estimated 1.6 million of the entire population of the United States. And there will be fewer trans and gender diverse people overall relative to cis counterparts, even in the district. As Professor John Blosnich of the LGBT Mortality Project has pointed out, it's not the total number of cases that tracks disproportion. What matters is frequencies, patterns, and trends that are overrepresented within one group relative to others. And that's the disproportion that we are looking at. I also want to avoid a scarcity mindset in thinking that we can only devote review and resources to one group over another, especially since identities are intersectional. So can you clarify OCME's concern about there being too few potential cases to warrant a committee? And couldn't this even benefit lowering the administrative burden given the number of cases?
Yes, I believe that our thought process was because there were such a small number of cases, per the data that was available, that we could absorb those cases into the reviews that we currently have. The structure of our committees that we already have in place to do that work instead of having to recreate another committee with an additional administrative burden, perhaps.
But how do you think that the existing work could support this effort of making sure that we are being very conscientious of the trends that we're seeing and then use those pieces of information to better inform how we can be better with prevention?
We are already reviewing the cases of homicide and suicide, maternal child developmental disabilities. So we already have the review structures in place. The issue would be in then going back through our decedent populations and working with DC Health to identify those individuals who in fact are transgender or gender diverse, and then try to categorize them. But we already have the cases that are already before our committees to be reviewed. So they would already be reviewed, what would be needed is the way to then develop ways through either training individuals, our staff, our members, how to even write reports, how to facilitate conversations around gender diverse and transgender to capture that information the way it would need to be in our case review summaries or in our annual reporting.
Okay. So I want to move on to another issue that you've raised around identification. So assuming we had a new standalone committee, there's been some confusion that I've heard from several folks about this bill. And I want to clarify that this bill does not require OCME and DC Health to jointly come up with a way to identify trans or gender diverse people. It just requires DC Health to establish a procedure to provide that information to OCME. This idea was suggested by DC Health. The bill also does not tell OCME or any agency how to identify trans and gender diverse people, it says that they, quote, must use their respective procedures that are already in place. It does say that in the case of that there exists a district agency that doesn't currently have a procedure for identifying trans and gender diverse people in its databases, that the review committee has requested records from them and that agency would have to establish procedures. Since OCME and Vital Records at DC Health already have a means of identifying these types of cases, this language wouldn't apply to you. So is your concern here on behalf of other agencies having to develop these procedures?
I think it's a mixture of both. So although DC Health has a process in place by which someone would have come forward with completing an application, and as we spoke about earlier about people might not being out or DC Health not having that information, but for that form, there is no other mechanism in place to capture transgender and gender diverse at this time. Other agency databases, there's no standardization in the demographic capture. Most databases and federally are male, female, maybe even unknown, but there's nothing across all agencies that capture gender diverse or transgender in a formalized, standardized way. So that would probably require other agencies to amend their data captures, change their demographic forms or the way that they include and track this information. And then a way has to be developed to provide that information to DC Health as well. And I don't know if the fiscal aspect of reforming systems that are in place to transform that information and capture have been assessed to be able to make that type of determination on the financial burden to do that.
Okay, thank you. I guess hearing you articulate the lack of consistency tells me even more so why such a committee could be so beneficial to help advise on the development of these types of procedures and make sure that there is perspective from a health perspective, from people with lived experiences, to community organizations, so that we can do a better job across agencies in this type of standardization.
And I appreciate the your response. And I believe that having that level of standardization would be helpful, and it would be necessary for us to further identify individuals outside of those who actually come forward. But there is also a danger in doing so. If people have, unless they've actually said that they wanted to complete a form, it's very subjective. So we could potentially mislabel someone. And then the data would be skewed in that direction as well. And sometimes it's not as feasible to do those type of assessments and labeling people in depth as it is to support the interviews and gathering their perspectives in life, which is what I believe the mayor's office of LGBTQ plus affairs is doing. They have the pulse on the services being provided and the issues that people are facing and are making recommendations to make and transform those. There's also additional ways that you can gather that information that may be more beneficial with those who want to come forward, and those are quality service reviews. There are other agencies such as Child and Family Services Agency that already does those. And a process could potentially be adapted where you're getting feedback from lived experiences, which might have more of an impact in identifying people.
Okay. Have you spoken to any other agencies about these concerns, about this bill?
I personally have spoken with DC Health to try to just learn more about their process and how that would affect me as the administrator of Fatality Review. I know we have also spoken with the Mayor's Office of LGBTQ+ Affairs. We have included them in a couple of our meetings, just trying to do a sample cluster, as you mentioned earlier, of what the case review process may be, and learning some feedback from that process to see if we were to implement and make cases a priority within our existing committees, what would that require?
Thank you.
If I can give you some context,
Sure.
I communicated with DC Health. They advised us that in FY '23, they received 61 birth, death, gender designation requests. And in 2024, they've received 31. They have not changed any death certificates based upon any of those requests. So we would have 0 at this point of actual deaths to look at under that scenario of where people have asked to designate themselves.
Sorry, just to make sure I'm understanding. There were 63 cases the first year?
There were 61 people who filed a request to designate a different gender.
61 people and 0 of them were honored?
0 of them died.
0 of them died, okay. So in time, that will be at least 61 people or at least 94 people who would be subject to this type of review, which
Sometime out there, yep.
sometime hopefully a very, very far
Assuming they stay in the district.
in the, right. I guess I just, those numbers again tell me how important a standalone committee is to make sure that we are looking at possible trends, health outcomes, to better understand, because this type of research is not being done anywhere in the country in this way. I worry that we're missing information that could
I hate to
help
step in
us
on-
help
on
people.
Jenna's, thoughts, but I agree with you 100% that this research needs to be done. But I think looking at deaths is only the tip of the iceberg from what the data that you're really seeking, which is how do we improve the health of DC citizens? And how do we also look at the social determinants of health for these citizens? And that's beyond the scope of what a fatality review can do. But I think that is certainly research that needs to be done out there.
Yeah, I hear you, and the work should certainly not start and end at fatality review. But I worry sometimes when we have the argument of, well, this isn't going to give us everything we need, so therefore let's not do it, when we've got to start somewhere to have the prevention that we need, that we all want to see. So we talked a little bit about the identifying. I want to zoom out a little bit around how OCME currently deals with identification problems with its other review committees and boards. Why is it so particular about this population for trans and gender diverse decedents that make the proposed committee's work more vulnerable to problems? For instance, is there another review board where a family member could protest, and couldn't that happen under current systems?
All of our criteria for current reviews are objective. If it's a opioid overdose, we've got that designation as the cause of death. Maternal death, we've got criteria of someone who died within a year of delivery. And so there's very objective criteria. As you all can appreciate, there is some subjectivity about designation of whether one is trans or another identification. And certainly families have very strong feelings about that as well. That may be consistent or inconsistent with what the decedent identified themselves as.
I guess I worry that implies a certain weight to give to family members for one category of cause of death or individuality that we don't apply in any other context. And
Well, yeah, but likewise, I mean, yeah, I was just stealing your thunder here. It's a challenge because we don't really have a good definition of if you are a different gender in a certain situation and not that gender, or don't want to hold yourself out as that gender in another situation, where do we make that designation?
Yeah.
And that's our, you know, as I expressed in my letter back in 2023, that's our challenge on the front end of identifying who would be in that pool. And not, you know, and trying to put some objective criteria to that. If it is only those who have self-identified through the EC Health process, then that's an objective criteria that could be applied. But if it is based upon, you know, investigation, based upon community input, family input, then you get into a lot of subjectivity.
Mm-hmm. Yeah. And we don't want to be putting OCME in a position to have to make those subjective determinations on a case-by-case basis, which is another reason that we think that this committee could be so useful. We currently have it structured as those objective criteria through the self-determination with DC Health as a option. But as you heard from some of the public witnesses, there is, I think, a fair point on the other hand to say, well, the steps to go through to say, I'm going to identify myself to the government, really just at my own volition, might not encompass everybody who is in this group. And so I hear you on the objectivity piece and don't want to put OCME in a difficult situation, but I hope that we can keep thinking through how to get that balance right so that we can be truly inclusive without creating so many subjective barriers for you all to deal with. Okay. So when we look at historical and national trends and advocacy, we find that families and loved ones often had to fight to have their trans and gender diverse loved ones correctly gendered on death certificates and other documents rather than the opposite situation. People have a human and legal right to be the genders that they are, irrespective of others' objectives and objections. And so I guess taking it to the extreme in the other way, what is damaging about misgendering someone after death by not appropriately identifying them as the gender they live by? This is why the district passed the Death Certificate Gender Identity Recognition Act, and why I asked about the performance oversight about OCME having no in-house training for death investigators with regard to transgender and gender diverse decedents. So if the agency has concerns about family objections, I guess, again, it would lend itself to me to have additional trainings about the importance of accurately being labeled in death.
In speaking with our investigative team, there is no formal standardized training curriculum that exists at this time. That would need to go through some national accreditation and also be determine how it will be conducted, the frequency of the training, what the tracking requirements would be, whether it becomes a requirement of licensure, and then the actual cost that would be associated with such, and for staff to be certified in that level of training. So it still needs to be developed on a national landscape for us to be able to implement that type of training.
Interesting. Okay, great to know. So for anyone listening, we are ripe for a development of a training. So thank you. Thank you for bringing that to our attention. So another concern that you all raised in your letter to the committee about the proposed bill was around OCME's jurisdiction. In particular, you said that creating a mortality and fatality review board was confusing and that perhaps the committee meant morbidity as in all injury and illness. Your letter then noted that morbidity issues would fall outside of OCME's jurisdiction since the committee would be reviewing deaths from natural and accidental causes in addition to violent deaths. And you said something somewhat similar in your testimony today. And so can you elaborate to me a bit more about your objection here. Why would trans and gender diverse deaths from natural and accidental causes be outside of OCME's jurisdiction when some of OCME's current review committees review the natural and accidental causes of death of children and mothers, opioid users, and those with developmental disabilities?
We don't, well, one has to distinguish OCME versus fatality review committees. OCME does not have jurisdiction over natural deaths. If they were anticipated, if it was a sudden unexplained death, then OCME would have jurisdiction. But the majority of deaths probably in the district are not under OCME jurisdiction. And so then you get into a collection problem of how do you funnel all of those records into a fatality review committee for homicide, for example, for our violence committee, all those records are already start in-house at OCME. Opioid deaths, likewise, we've already got all of those records. For this population, we may or may not have those records. And so it would certainly broaden the scope of the FRCs to be doing that for natural deaths.
Thank you. I want to note on the question of morbidity that our code does recognize and define severe maternal morbidity. So even though this bill doesn't use the concept of morbidity, morbidity is still within OCME's jurisdiction, and we could modify the code if we needed to ensure that it was inclusive.
Right. If you look at that statute defining maternal mortality and then the morbidity sub-definition under that, it gets a little complicated, but in essence, it's, what contributed to the death. And it lists out a long list of things that contributed to the death, which is that morbidity list. Why they distinguished that as a morbidity as opposed to a contributing to the death, I'm not clear. But the council in its wisdom did that.
Understood. Thank you. So OCME has also expressed a concern that a new committee would produce too much overlap and duplication. How does OCME's focus and cluster on LGBTQIA+ people in existing committees produce results and analyses that avoid coordination and overlap problems in your current structure?
Within our current structure, we have increased our level of partnership, especially in those homicide cases that overlap with domestic violence, and our violence committee, as well as our child fatality review committee, which also reviews homicides as well. So it is a question of what led to more so circumstances. Did the individual, were they already engaged in domestic violence services, then that would probably be best reviewed by the Domestic Violence Fatality Review Board, since they're familiar with the services, as opposed to maybe the Violence Fatality Review Committee, which may not be as well versed on the service side in order to make those recommendations. So sometimes we pick a lead committee or board who's going to review. The hope is that any recommendations that come would then be shared with that other committee that would also have to review the case. We try to coordinate so that we can have members of various committees at various meetings if necessary to really heighten the recommendation process. But sometimes we do have to review, and sometimes there will be duplications because of member expertise at the table if we're really looking to drive home those recommendations for systemic changes.
Thank you. So with the full anticipation that we are going to work together on this, I want to be open-minded and collaborative to the concerns that you all have, and hope that we can move forward in a way that provides the district with this needed information to improve the lives of trans and gender diverse residents, and in a way that can be workable and implementable for OCME. And so we look forward to continuing those conversations. I want to ask about, lastly, some additional ways to make this legislation more workable from your perspective. And so I really appreciate that OCME has started an LGBTQIA+ focus in some of its review committees, which we've discussed today. And I think a lot of this work can be done in addition to this bill, not necessarily in replace of it. This bill guarantees a convening of experts and stakeholders directly affected by trans and gender diverse issues to produce a first of its kind report, which is an essential piece of data overseen by experts and relevant stakeholders that I hope can really serve as a model for other jurisdictions around the country. And as I've mentioned, some of the ideas and concerns shared kind of bolster my view even more that this committee is really needed. I do want to ask about staffing to make sure that if we move forward, we can make sure that the agency has what you need. I'm sensitive to the need to make sure that your agency is properly staffed and supported, and I'm very grateful that OCME provided an initial list of staffing that would be necessary at a minimum, including one full-time staff member to analyze records and coordinate meetings, a staff assistant to request and manage records, and an additional manager. Are there any other staffing needs that you all would have besides those listed, or any other resources you think would be most helpful to get something like this off the ground?
For the FRCs, I think that covers it, but the related question is how far down the pike do we go on the training of investigators and so forth? Any additional training would require funding and potentially additional investigators if there's a more onerous is not the right term, more in-depth investigation into gender identity.
Makes sense. And I don't know how widely viewed these hearings are, but again, if maybe we have someone listening today who is aware of some training in development that we'll continue to work on and spread the word about that. So thank you very much. Really appreciate you both being here. I want to thank again our public witnesses and all those who have been a part of this process in developing this bill. And we look forward to continue working together as we move forward. Thank you both. We are now going to turn to proposed resolution 25-591, the District of Columbia Sentencing Commission, Sean Holohan confirmation resolution of 2024. We have one public witness testifying virtually today, and then we will turn to our nominee. Before calling on our public witness who will be appearing virtually, I do want to note one procedural error in the hearing notice for today regarding the closure of the hearing record. The hearing notice says that the record closes on April 10th by 5 p.m., but this date is after the council has to vote on this nomination, which will be April 2nd. So to be clear, the hearing record for Mr. Holohan's nomination is closing today at midnight. Today at midnight. Any interested members of the public are invited to submit testimony by midnight today, after which the hearing record will close. Again, today's date is Thursday, March 21st, and the hearing record closes tonight at midnight for Mr. Holohan's nomination. I'm going to call our first and only public witness today, Aaron Earp, public witness, who will have 3 minutes to present their testimony. All right. I don't see Aaron Earp. Okay, Aaron Earp, we invite you to submit your testimony in writing by tonight at midnight. And with that, we are going to move on to the nominee, Mr. Sean Holohan. Please sit wherever you're comfortable. Mr. Holohan, it is the tradition of this committee to swear in all witnesses who appear before it, and all government witnesses and all nominees. So if I can ask you to turn your microphone on by pushing the button there and raise your right hand. Do you swear or affirm under penalty of law that the testimony you're about to provide before the Council of the District of Columbia and this committee is the truth, the whole truth, and nothing but the truth?
I do.
Great. Thank you so much. I would now like to invite you to make any opening statement you may have.
Thank you. Good afternoon, Chairperson Pinto and the Committee on Public Safety and the Judiciary. I'm grateful to have this opportunity to be considered for appointment to the DC Sentencing Commission. And we'd like to thank the Mayor, Muriel Bowser, for nominating me. As a 10-year resident of Washington, DC, I have continually looked for ways to serve the district. I was elected as an ANC Commissioner for the U Street area and have served on the Concealed Pistol Licensing Review Board until the board's responsibilities were reassigned to the Office of Administrative Hearings in October of last year. I believe my work experience will also allow me to provide a unique and valuable perspective to the work of the Sentencing Commission. Over the last 5 years, I've overseen the legislative campaign efforts for the Rape, Abuse, and Incest National Network, also called RAIN, in Giffords, working in the field of sexual assault and gun violence prevention, respectively. Prior to that work, I spent over 5 years as a consultant for such organizations as Ceasefire Pennsylvania, the Commonwealth's largest gun violence prevention group, and the National Association to Protect Children, an organization dedicated to protecting children and families from sexual assault and child abuse. That work has provided me with a deep understanding of the impact sentencing policy has on victims of crime, perpetrators, and our communities, and have often worked directly on legislative reforms that impact sentencing. Nearly every bill filed by a state legislator that deals with the issues of gun violence and sexual assault has a carceral impact. And state legislators have often no staff to lean upon for drafting legislation. They depend upon outside experts, like those at Giffords, to propose and often draft statutory language and look to those experts for advice when it comes to right-sizing criminal penalties for criminal acts established or changed in a proposed bill. In fact, one critical part of Giffords' mission is to educate lawmakers on the impact criminal penalties have on communities of color. This may mean we draft legislation that includes a first-time misdemeanor charge for certain acts, such as having a high-capacity magazine, or improperly storing a firearm, or insist that a bill is amended to pare the penalty down in order to gain or keep the organization's endorsement. A key part of that work is ensuring any changes we propose are evidence-based and convincing both the policymakers and the public. In September, I was approached by the Mayor's Office of Talent and Appointments about the Sentencing Commission after I asked them for help finding a board or commission once my service on the Concealed Pistol Licensing Review Board had ended. After reviewing the Sentencing Commission's website, mission, members, reports, trainings, and other documents, I told MOTA that I would be greatly interested and honored to serve on the commission. I believe my years of work crafting legislation with a carceral impact, with a focus on the needs of underserved communities, will be beneficial to the work of the commission. My first priority as a member of this commission will be to learn from and develop relationships with the other members and Sentencing Commission staff. Their years of service to the district and the work they've done in their careers speak volumes, and I will be fortunate to serve alongside them. Additionally, as I've done throughout my career, I look forward to the opportunity to review and compare other locality sentencing commissions to see if there are ideas or strategies that the district could benefit from. Further, I've always prided myself on my ability to quickly absorb complicated information and distill it down to what I call USA Today language. If selected, I hope to put those skills to work for the commission and their presentations to the public and in their publications. Deciding how long someone serves time in jail or prison or probation or parole is not easy. Each plea agreement or sentence handed down changes a life, and the Sentencing Commission provides a valuable service to those in the criminal justice system by producing and tracking implementation of voluntary guidelines every single year. Further, the Commission's reports, brochures, and videos are an important tool to educate the public, policymakers, and activists on sentencing policy and reform in the district. It will be an honor to join those on the Sentencing Commission and continue to serve this city. Thank you very much for your attention, and I'll be happy to answer any questions.
Great. Thank you so much, Mr. Holohan. And let me just say thank you for all of your service and all of your work, particularly with organizations focused on reducing gun violence. It is so needed in the District of Columbia and around the country. Appreciate it.
Thank you.
As we think about our Sentencing Commission, and this is a important time for the Sentencing Commission going through expansion, going from 12 voting members to 15 voting members after the passage of my bill, Secure DC. I want to understand a little bit more about your vision for the Sentencing Commission, if confirmed. In your testimony, you said that you would lend your own experience of working on legislation with a carceral impact to the commission. I want to understand a little bit more what you mean by that.
Sure. I think one of the reasons why I was approached by MOTA is because of my years of experience in crafting legislation and working with legislators on understanding the impact that their recommendations have. As a legislator yourself, you certainly understand the need to balance what the community is asking for versus what we understand data tells us about sentencing, both in reforms and in what people see when they're in front of a judge. And so, there's been many times when I've worked with legislators across this country, progressive, moderate, conservative legislators, who want to do what's best and don't really have an understanding of what the impact a felony charge versus a misdemeanor charge. The reason I mentioned in my testimony about endorsing is that we have often pulled our endorsement from a piece of legislation when, to answer communities' concerns, a legislator has put into writing a first-time offense would be a felony. It is not a blanket statement that we would pull endorsement, but oftentimes we feel as though if there hasn't been enough public education on a new piece of policy like high capacity magazine, someone could be caught up and suddenly a mistake could turn into a felony. And as we all know, that's a life-changing sentence. So I think I bring a little bit of a diverse perspective to the Sentencing Commission because I'm not an attorney, I'm not a judge, but I am someone that has worked in over 25 different states on legislation that does have legislation that includes different types of penalties for crimes that have been committed. And so I hope to be able to bring that expertise. However, as I stated, this is very new to me. And I'm not an attorney. So for the first few months, perhaps 6 months to a year of my service on the Sentencing Commission, I have a lot to learn. And I do not come in and as my way of doing things as well in states. I first learn, I build a coalition, and then I see how I can uplift the work.
Thank you. Can you tell me a little bit more about your experience on the Concealed Pistol Licensing Review Board and any knowledge that you gained from serving on that board, especially as it could relate to the work on the Sentencing Commission?
Sure. One of the reasons I pointed to High Capacity Magazine was because in one particular circumstance, there was a concealed carry permit that the chief had decided someone did not deserve, and so revoked that right. Where that came about was it was a situation where a car was pulled over. There were 4 men inside, and in the police statement, there was a seatbelt that was not being worn. And the car was pulled over. All 4 men inside were searched, and the trunk was searched, again, for not wearing a seatbelt. Now, we upheld the chief's decision because it was our duty to follow the rules that were given to us. And it was clear that there was a gun in the trunk, and it didn't belong to anyone. So it was a legal firearm. Now, there was a potential situation where all 4 men were charged with in possession of an illegal firearm, again, for an unbuckled seatbelt. Now, it is often my work across the country to sort of educate people on the need to have strict laws. We cannot have illegal firearms in this country. And it is a bit of a give and take with the progressive side of things versus the more moderate side of things to get people to understand that we can't just strike laws that say people shouldn't have or shouldn't be walking around with illegal firearms. However, I did take exception to the fact that 4 men were searched and a trunk was searched for an unbuckled seatbelt. That did change the life of someone. Now, was he committing a crime by having a firearm that was unregistered, that was potentially illegal? Yes. Did the other men in the car know that there was a firearm in that trunk? We don't know. And so I think that particular circumstance showed me the nuances of law and the different impacts that sentencing could have on different people. And so I try to bring a little bit of that perspective to each and every single piece of legislation I work on, and hope to be able to bring that to the Sentencing Commission if confirmed.
Thank you. So the Sentencing Commission promulgates voluntary guidelines for our courts, but judges in DC follow those guidelines over 98% of the time. And so different people will phrase this different ways, but I am of the view that those are very impactful guidelines when there's that level of rate of compliance. we also have different standards than the federal sentencing guidelines. In your pre-hearing responses, you've said that the District of Columbia Sentencing Commission can, quote, serve as a model to the federal sentencing guidelines. Is there a particular guideline that you have in mind that should serve as that model, or why do you think that the district's guidelines should be serving as the federal model versus us looking at the federal guidelines here in the district?
The reason I said that was because, up until a few years ago, before the Biden administration, there just wasn't really a functioning sentencing commission on the federal government. So whenever I work on legislation across the country, I first and foremost compare what other states have done and have been potentially successful on. With a 98% follow rate, it seems as though those sentencing guidelines have been rather successful in the District of Columbia. So it felt as though the federal government could look to the district as a guide. That's why I said that.
And when you say it seems as though they've been successful, what do you mean by successful?
Well, considering they're voluntary guidelines, the fact that the judges have seen to it to follow along those guidelines seems as though the judges accept these as acceptable guidelines.
I see. Okay. So I want to ask you a little bit about split sentences, and your kind of thoughts on this practice. And so one of the concerns I hear about sentencing practices in the district is that the vast majority of sentences are eligible for probation or a split sentence, in which most of the sentence can be suspended, meaning the person doesn't go to jail. This could yield to an environment in which relatively serious violent crimes like aggravated assault or assault with a deadly weapon could in practice result in much shorter sentences than the guidelines seem to initially dictate or contemplate. Long sentences can be a driver and are a driver of mass incarceration. And I do not want to suggest that we go back to an environment where we're proposing 30, 40, 50, 60-year sentences from our past. But I do want to better understand, as we continue to work with the Sentencing Commission, the effect of the wide range of offenses that we now have eligible for probation or split sentences, and how the Sentencing Commission considers this factor in its decision-making. We know that the certainty of prosecution and what sentence is being applied for is important for deterrence. And I think is a consideration that the Sentencing Commission and all of its members need to take really seriously. So in your pre-hearing responses, you say that split sentences can, quote, be useful, but that studies are mixed. I know that this is a complicated area, and there are a number of different offenses that qualify, but could you describe kind of generally what your views are on split sentencing in the district as we have them in the guidelines, and what your approach to this would be if you are confirmed?
Sure. Thank you for the question. It was honestly very interesting to read more and research about split sentencing in the district and across the country at large. It's clear that these are used in far less frequently in the district versus other sentencing measures. And that seems to be because there needs to be more education on how they're used. Also, the reason why I said that results are mixed on this is because education done for those who are handing down the sentences, but also split sentencing has shown sometimes not to work as well because probation is either too strict or perhaps not strict enough. And I do worry about very violent criminals being let out on probation. I do feel like split sentencing should be utilized more for nonviolent offenders.
Got it. Okay, thank you very much. Well, that concludes my questions to you. I do want to give you a chance if you have anything else you want to highlight or share for the record that we didn't get a chance to talk about today.
No, thank you very much for the opportunity.
Okay, wonderful. Well, thank you, Mr. Holohan, for your interest in serving the district in this capacity. I also want to remind the public that the hearing record for Mr. Holohan's nomination closes at midnight today. Members of the public who would like to submit testimony have until then to do so, and this corrects an error that we had on the hearing notice. There being no further business before the committee, the time is now 2:27 p.m. on the same day that we started, and we are adjourned.